All right, I see here that you were admitted for a pretty severe manic episode. You know, your diagnosis is now bipolar disorder, not depression. Once you have a manic episode, that's what it becomes. There are a host of things for you to know about bipolar disorder. But first, how are you feeling? Bipolar disorder. Man, I'm not that familiar. They just said I had depression. I'm just sad when I was really happy. All right. It's tough. It's tough. I think I'm sad for myself. Those feelings are normal. It's a hard diagnosis to have, especially knowing this is not the only episodes you'll ever have. And you have medication for life, all of those things. Yeah, that's really hard. I feel for you on that. There's another thing you need to know about bipolar disorder that a lot of doctors don't tell you, but you need to know. As you progress and get older with bipolar disorder, it can affect your brain. My brain, it doesn't already affect my brain, but what do you mean? What's gonna be wrong with my brain? Yes, weird, I know. It all starts in your brain with manic and depressive mixed episode psychosis. But it really affects your brain as far as you may suffer cognitive issues at some point, memory issues at some point. You can develop white spots on your brain. No one really tells you about these white spots. They can be difficult to manage. I'm sure you have questions about that. What white spots? Like, what do they do? Do they go away? If I don't have an episode, like they go? Because that would be great. I don't really like what you're saying. Well, we don't actually know. So we don't know if they go away. We don't know if they come during certain mood states. There are risk factors. And this is why it's super important for medication. One, the more hospitalizations you have, the more manic episodes you have, and the more and longer that your psychotic episodes last are all risk factors for more brain damage. People in my field don't like to call it brain damage, but that's what it is. So, do you have more questions that maybe I can answer about it? So, what causes it? Mania, depression, psychosis. I would really like to know. So, I don't know, just protective factors in my life, so I don't get this. Yeah, I don't know the answer to that either. Again, they know white spots appear, they know what they can affect, but they have yet to study which episodes cause what, other than they know more hospitalizations, longer psychotic periods, and the more manic episodes you have, the more severe your disorder is. But more people need to know that brain damage can come. This is a heavy subject. Why don't they talk about it? It helps me to know how I can better help myself. So thank you. Yeah, brain damage is a pretty hefty thing to say. I don't know what to tell you. It happens, and a lot of people who have bipolar disorder wish they had done things differently. The 20s, normally people are like yourself, are on and off meds continually. Then there's your 30s, sometimes you're on meds, sometimes you're not. Just depends. 40s, sometimes people get a little bit more real. But the more that your disorder can be managed, the better your life will be with it, across the board, and especially for your brain. I hope that this has helped you, and that you tell other people that bipolar disorder can cause brain damage. It's a fact. It's in the studies. The majority of people who have bipolar disorder often has these issues with their brain. And it's finally time that we tell them.